must learn how to say no. Say, I do not want to have sex. I have chosen not to have sex.
At the beginning, the approach was ABC. A standing for abstinence, B standing for be faithful, and C means use of condoms. There are people now who believe there should only be AB, abstinence and being faithful, full stop.
The fear of God.
Our major goal as a country is not to promote promiscuity, it's to promote abstinence. It's abstinence, it's being faithful, and it's appealing to the faith value of the people.
There are a lot of organizations now that would previously not have done abstinence only, but they are doing that because this is where the money is.
To meet a severe and urgent crisis abroad, tonight I propose the emergency plan for AIDS relief, a work of mercy beyond all current international efforts to help the people of Africa. I ask the Congress to commit $15 billion over the next 5 years to turn the tide against AIDS in the most afflicted nations of Africa and the Caribbean.
Last year, when the AB approach began to be marketed, the promotion of condoms was more or less silenced. That implies that we are exposing people more and more to risks that were previously being avoided.
Uganda's approach is responding to what money is telling them. If the new rules are saying you must, in order to access our money, you must promote abstinence, people will do it.
Now, this is a card. We are not forcing anyone to sign. They are 2 in 1. So you're going to sign both of them. It's a reminder that you chose to wait for that person very special for you. Okay, pick a card from there. Please sign. It's a commitment to abstain. It's a tangible commitment. It's evidence to everyone. Every time someone tries to push you to have sex, you remember that this is something I did.
Ekintu ekyo nakirabako nalinako ne bakwano bange babiri abamu babikozesa fujjo abamu bakikozesa fujjo wangaza bakwano bange bakikozesa fujjo ne betekako obuntu obwo already baali balina ki abalenzi babwe ngamba manyi.
Being a virgin is good and it should be promoted, but should not be promoted against prevention, because prevention is not virginity.
The abstinence-only programs do not take into account the reality on the ground. Because when you stand up and you say to young people, all we can give you is abstinence, when you know that some of them are already sexually active, I think that is irresponsible. I think it is irresponsible.
Many men tried to sleep with me, but I could not. I never thought it was wise to break my virginity. I met him on 1st of June 2001. We went to a movie. We came back home. And he would put on that music. I'm your Romeo, would you be my Juliet? And then he would ask me, would you be my Juliet? And I would laugh and have fun. I told him to use a condom, and we discussed it and he agreed. I just heard of effective use of condoms, but I never knew how to use them. I'm sorry. Okay, I don't get so angry because I don't remember him all the time. But when I talk about him, it wakes some pain in me because my life was just beginning and he ruined it. He ruined all my dreams.
You must know what you will do the first day you engage in sex. Whether it is on your 21st year, on the 41st year, or on the 100th year, you must know that once I graduate from being abstinent, this is what I do.
I had abstained for all this long, and this once, just once, and here I am, HIV positive.
To strictly say abstinence only, it's like walking into a hospital ward and having all these patients with different ailments and saying, okay, this is the prescription. It is the same prescription for all of you.
Kyetaagani oba ne wakolebwawo programs abantu ng'abo nga babuulirirwako oba ku radios bakozesenga kondomu.
You make it in a ring this way.
Today we have a disease, and if one of the ways by which we can prevent its spread is the use of condoms, for God's sake, we've got to use it.
Ladies and gentlemen, seldom has history offered a greater opportunity to do so much for so many.
If they really, really are interested in turning the tide and helping African countries, put money into programs that promote more than abstinence.